Hello everybody, welcome to the practical demonstration of Rosagate Professional, a new in-clinic treatment not just for vascular rosacea but also for papulopustular rosacea. We have our model here, Jackie, who we're going to apply the functional solution to. It's not a peel like any peel, so you don't have to protect the eyes, you don't have to protect the lips, but we've just taken some precautions so it doesn't get on Jackie's hair or in her clothes. So that's the outer box. In the open box, the elements of it are, you have a functional emulsion, you have a brush applicators, we have the Rosagate mask sachets that we apply afterwards, and these are the prep wipes. So I've got one of each of these here. So this is one of the prep wipes which we'll apply. Inside these vial packs are the functional solution, the vials of functional solution. So I'm going to just take one of those out, leaving the other ones in. So you've got 2 mils of solution, and there's little 1/4 mil markings down the side, so you can see how much you apply. But to be fair, you apply the full amount, and that comes with a brush head, which if I just twist this top off, now by twisting the top, you just twist it until it comes off on its own. Don't sort of stretch the plastic. Literally apply the brush head, and that's primed and ready to go. Here we've got a sachet of the Rosagate invisible transparent mask, which will be applied after the functional solution has been absorbed. This absorbs within a minute or so, and then we can apply the Rosagate SPF 50, which is one of the new at-home use products that goes with this professional range. So first things first, we're going to get the prep wipe out. Now, you might want to keep your eyes closed, Jackie, and there's more than just alcohol in these. They are deep cleansers, but they are the right medical cleanser required for this procedure. So if we open this up, you can see that the best way, and then just with 2 fingers, just gently apply it to the forehead, and just in a gentle sweeping movement, just try and remove any. I mean, Jackie's already not wearing makeup and has cleansed her skin, but this is just taking it to a slightly deeper level. Are you all right there?
Yes.
Some people find this quite strong solution, so sometimes I suggest they hold their breath. But yeah, it's taken off a little bit. It's taken off what the makeup remover didn't take off, which is not a lot, so you've done a good job there. You okay?
I am, thank you.
So if you open your eyes, you can see that's all we got. But now, so the skin's now cleansed, and what we're going to do is I'm just going to pump this up a bit so the solution comes out of the hole into the brush, and we're just going to apply the solution. We're going to focus on this area for rosacea. That's the area that we'll mostly use. So we're literally going to draw it out onto the skin like so, gently apply it to any areas that are prone to reddening or where you may have some damaged blood vessels. Is that all right? Everything fine?
It is, yeah, thank you.
Should just feel like a cooling solution, really. I'm just going to come across here as well. Now, this is good for any inflammation. It's not just rosacea. We found people who've had strong reactions to TCA peels. This will rapidly reduce erythema and redness, and is a soothing, calming solution. It does contain the RO peptide 23, which is the product that inhibits the antimicrobial cathelicidin production, and it's excessive production of cathelicidin that leads to papules and pustules in subtype 2 rosacea. We also have 2 other ingredients, the MSM and the 40-butyl cyclohexanol, which can interrupt a number of inflammatory pathways that lead to flushing and redness. How does that feel? Okay?
Fine.
You've got quite a lot on here. Get the full treatment. Now you just leave this to absorb, but I find that if you continue to gently brush it, we nearly got it all out. Now you can see that Jackie has got a little bit of redness around her nasolabials and a bit on her chin. I don't think you have rosacea as such, but you are prone to the odd flush, I would think, or the old. So this, you should see this change over the 10-15 minutes. So, and you have got enough in a sachet to do a whole face. And this just absorbs, you don't need to wash it off. It'll absorb into the skin. It has the peptide in again, so again, if you've got papulopustular rosacea, but it also will work on the vascular elements as well. I'm not going to put much on the forehead because you don't really need that much on the forehead. And there it's, so all in all, it's a very simple procedure, and even me, and I'm a lab scientist, I'm not a therapist, so I apologise if I've not got the techniques that beauty therapists and nurses and doctors have. But that's it. So you just let that absorb, and while that is absorbing, I'm just going to take my gloves off here so they can go into the disposed. And I'll just bring these products up. So here we have the well-known Tebby Skin Soothe Clean. So this is a cleansing gel which you can put on neat onto the skin and let it absorb, and then just wipe off any residue. And that's a soothing, calming cleanser containing MSM. And then we have these new Rosagate products. So we have the Rosagate 24-hour cream, which is used morning and in the evening. This is an alternative to the Synchro-Rose Fast. This has the same 4 ingredients, but it's a much better technology cream, so you actually get a greater benefit from it. In the morning, that is then followed by the Rosagate SPF 50 Plus. Now this has similar ingredients to Synchro-Rose Intensive, but it also has the addition of magnolol. Now magnolol, which comes from the magnolia tree, also has powerful anti-inflammatory action. The SPFs are based on zinc, but we use Synchroblock technology, which is patented technology that stops the zinc from penetrating into the skin, because we know that some of the metabolites of zinc can be what are known as endocrine or hormonal disruptors. So we have zinc in there. We don't like titanium because that's even worse as a disruptor of hormones, but also titanium is very attracted to the lipids that make up your skin cell wall. And the last thing you want to be doing is irritating skin cell walls if you've just had an in-clinic treatment. The other SPFs in here are plant-based, known as phyto, P-H-Y-T-O, phyto SPFs, and that's applied in the morning. At night, you'd go through the same program of using the Soothe Clean, followed by the 24-hour cream, and then you have a version of the mask which is in the sachets, so Rosagate mask, and again if I pump that out you can see it's a clear gel, and that can be used at night time, and literally that absorbs similar to the one we're seeing here, and then when you wake up in the morning your skin is all nice and refreshed. So that's the at-home use products, which goes with the Rosagate Professional. And as I mentioned in the previous video, you can precede this treatment with the N-Apeel mandelic acid. N-Apeel MA is medically licensed for vascular rosacea because we can take the mandelic acid deep into the skin where the dilated visible blood vessels are, and if they still have integrity to contract, then if you can get mandelic acid to where they are, it is a vasoconstrictor. We also have a high level 5% MSM, methyl sulfonyl methane, in there, which also is taken down to the dermis, and that inhibits a growth factor called vasoendothelial growth factor, and VEGF is used when you need to make new blood vessels when you've had damage. But in rosacea sufferers, their VEGF is overactive, and that's what leads to the excessive production of new capillaries, leading to the veiny face. So we have those two features in the N-Apeel MA, and that's a 10-minute exposure to the MA, and then you could follow it immediately by doing the Rosagate Professional. And we think that combination, which takes about 40 minutes to do both, is going to be the real game changer, particularly in papulopustular rosacea and increases our activity in vascular rosacea as well. How's it feeling?
Good, thank you.
So we're just going to let that absorb, but in effect we've finished the treatment now. It should be calming. You are a little less. You weren't very florid before, you're even less now. But as I've taken my gloves off, you can rub in the rest if you want, but we're effectively finished. We'll just let that absorb now.